Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Sprint. In 30 minutes, we are going to master 100 facts. Every day as the days are nearing to reach the neetpg, हमको टेंशन बढ़ रहा है. किसका टेंशन? रिविजन करने का टेंशन. Always your revision should be crisp. That's the reason your reading also should be very focused, limited, sure shot, which is going to be asked by the examiner, PYQ analysis based. And if you do hard work for hardly 300 hours of reading room, is more than enough if you are having the right material in the hand. So what is the purpose of these sprint sessions? The whole purpose is to master the most commonly tested items in the shortest period of time. So let's make the great beginning, doctor. With that preamble, let's take up the pharmacology sprint. 50,000 high-yield facts totally. We'll be conducting around 500 sprints, by the end of which you have 50,000 high-yield facts revised. So this PDF is available freely. Please do call the number which is mentioned below for you to get the PDF. Can the online students punch? Is the voice loud and clear for all of you, doctor? Can you please punch? Yeah. So let's make the great beginning. ACE inhibitors. What will you remember? Cough, rash, proteinuria, angioedema, dysgeusia. And ACE inhibitors are strictly contraindicated in pregnancy because they are teratogenic. NSAIDs, just like NSAIDs, ACE inhibitors also lead to hyperkalemia. There is a hyperkalemia risk in renal impairment. They are contraindicated in pregnancy. In diabetic nephropathy, the first line treatment is ACE inhibitors. If at all one question is going to come tomorrow, it is going to come from these 5-6 facts about the ACE inhibitors. Acyclovir lead to crystalluria. Acute tubular necrosis leads to renal tubular obstruction. That's the reason whenever you are giving acyclovir to the patient, make him to receive the IV fluids to lower the risk of acute kidney injury. Both HSV, varicella zoster virus, acyclovir is good. If you don't hydrate well, it can lead to nephrotoxicity. And in renal impairment, you need to alter the dosage of acyclovir. Amantadine can lead to ataxia, lividoreticularis. It is used in Parkinson's and influenza A also. Amantadine, please don't forget. Amantadine has anticholinergic effect. There is a drying of the mouth. Amantadine renal dosage adjustment is required. Now comes aminoglycosides. What will you remember? Ototoxicity, nephrotoxicity leading to acute tubular necrosis, especially with emic acid. You need to do a drug monitoring. Aminoglycosides and beta-lactams are synergistic whenever a patient has an enterococcal endocarditis. In enterococcal endocarditis, only giving penicillins is not adequate. You need to combine aminoglycosides with beta-lactams. In enterococcal endocarditis, aminoglycosides can lead to neuromuscular blockade. That's what you need to remember. To lot of elderly patients, we give amiodarone. Everything, anything about amiodarone, you need to be ready with for the tomorrow's neetpg. Amiodarone typically, acutely can lead to AV block. It causes AV node become refractory. That special property makes it useful as antiarrhythmic. But that property, when it is excessive, lead to AV block. Amiodarone can lead to hypotension. Amiodarone can lead to bradycardia. And long run में क्या होगा amiodarone से? Pulmonary fibrosis. And cornea verticillata. There is a peripheral deposition leading to bluish discoloration of the cornea. Arrhythmias, both hypo and also hyperthyroidism are seen with amiodarone. Please don't forget. जस्ट हाइपो इज देयर, हाइपर नहीं होता, नहीं समझना, दोनों होगा एमिडारोन में, बोथ हाइपो एंड हाइपरथायराइडिज्म is what you should remember. Immunoderone has a long half-life, 58 days. Always when you give Immunoderone, what will you check, doctor? Monitor the liver, monitor the thyroid is very, very important. Very nice to see 9 classmates. Kuldeep, thanks for the feedback, loud and clear. Very good, doctor. So we should keep doing the sprints. Sprint is a very fast way by which you can do the revision, doctor. Right? Now comes amphotericin. So please don't forget amphotericin. Amphotericin, whenever you give, where will you give amphotericin? Amphotericin is given whenever your patient is having a very bad systemic mycosis, fungal infection. So then you need to give a systemic antifungal, and amphotericin is always the best one. Fever, rigors, nephrotoxicity, bone marrow suppression, anemia, and very important, amphotericin goes and acts on the renal tubule. That's the reason hypokalemia, hypomagnesemia can occur. That's the reason we use liposomal form of amphotericin, which is less nephrotoxic. And always, before you give amphotericin, give an antipyretic as a pre-medication is very, very important. So that is the story of amphotericin, doctor. Now, let's go to antihistamines. First generation antihistamines, they have a lot of anticholinergic effects like oral dryness of the eye, urinary retention, etc. They lead to sedation, drowsiness. Always be careful while giving the drugs that can lead to drowsiness in elderly, because that can lead to a fall. Risk of falling down is there. And for allergic rhinitis, insomnia, antihistamines are good. Coming to antipsychotics, antipsychotics basically antagonize the dopamine. That's the reason they can lead to drug-induced Parkinsonism, tardive dyskinesia, neuroleptic malignant syndrome, sedation, acute dystonic reaction. And whenever you are giving antipsychotic, patient may gain weight. In psychosis, they lose the weight, but if you give antipsychotic, that can lead to weight gain, diabetes, dyslipidemia. Antipsychotics can lead to prolongation of the QT interval. When do you call prolonged QT? Normal QT is how much? 420 milliseconds. Any QT interval longer than corrected QT interval longer than 600 milliseconds is called prolonged QT. That can lead to polymorphic ventricular tachycardia is what you should remember. Antipsychotics can lead to hyperprolactinemia because dopamine inhibits prolactin. If antipsychotic inhibit dopamine, there is no inhibition on prolactin, hence hyperprolactinemia. Leads to gynecomastia, galactoria. Already patient is psychotic. Oh my God. A psychotic getting gynecomastia will have a different psychotic effects. Now, doctor, azoles, fluconazole. You should remember, azoles are inhibitors of P450. Azoles can cause hepatotoxicity. Azoles are very effective in candida. Always whenever you give fluconazole, very commonly we give 200 milligram fluconazole whenever somebody has a very itchy, pruritic, vaginal pruritus is there due to candidiasis, we give fluconazole 200 milligram. But monitor the liver function test whenever you give fluconazole is what you need to basically remember. Azathioprine, you should remember what does azathioprine will lead to. So doctor, let me quickly post it. All right. Now, azathioprine, diarrhea, leukopenia, hepatotoxicity, and it required TPMT, enzyme activity testing. Where do we use azathioprine? Transplant rejection, prophylaxis, autoimmune disorders, idiopathic thrombocytopenic purpura-like conditions, and azathioprine being immunosuppressant, it can increase the risk of infections is what you need to remember. Then all of you know zidovudine, otherwise called azidothymidine. Zidovudine. Zidovudine can lead to bone marrow effect, thrombocytopenia, megaloblastic anemia. Where do we use zidovudine? In HIV treatment and prevention. But zidovudine can lead to lactic acidosis, hepatomegaly risk. Zidovudine can cause myopathy. Please don't forget, so many times asked in the neetpg exam. Can the online student can punch? Are the letters clear for all of you, doctor? Otherwise, I'll increase the font size in this. Can you please punch? So please don't forget to give likes, as many likes as you can, and also please share these print sessions of YouTube link to all your friends. और इसके नीचे आपको मिल जाएगा phone number which will help you to give a call and request to join in our WhatsApp study group. And please post the link of this WhatsApp study group to all the friends in your social media so that they also can take the advantage. Totally 500 sprints will take around 250 hours of time, and that will give a rapid revision of almost 50,000 hygiene facts freely made available on the YouTube channel. You don't need anything else to read. Please go to learnograph.com. I left the link below. There you have all the ebook PDFs for you to download and do the revision. So now, doctor, beta blockers. Beta blockers can cause exacerbation of asthma, and in insulin-dependent diabetic, if you happen to give beta blocker, it can mask the hypoglycemic symptoms. If you are giving beta blockers to treat hypertension, especially propranolol, what will patient will tell you? Doctor साहब, इतना अच्छा दवा दिया, मेरा बीपी तो अच्छा हो गया, मगर बेगम के साथ अगर मैं जरा खुश होने की कोशिश करे तो बात उस दिनों का नहीं हो रहा है डॉक्टर साहब. So impotence is one of the problems with early generation beta blockers, like the propranolol is what you need to remember. Similarly, beta blockers can lead to bradycardia, AV block, congestive heart failure. First line for the treatment of CHF is beta blockers. Beta blockers decrease the myocardial oxygen demand. They decrease the heart rate and help in CHF. But you need to remember, if it is an acute decompensated class 4 heart failure, there the beta blockers are contraindicated. Beta blockers can lead to fatigue. Beta blockers can lead to depression is what you need to remember. Next comes the benzodiazepines. Sedation, dependence, respiratory, depression. They are the problems with benzodiazepines. You find so many patients in day in out, day out practice where they use alprazolam. Doctor sir, please write the prescription, doctor. My stock is over. So they are used for anxiety, seizures, alcohol withdrawal. They are short-acting ones. If they are short-acting ones, they have higher addiction potential. Flumazenil, if at all somebody takes a lot of benzodiazepines and comes to you almost like a dead body, if you give one shot of flumazenil, they'll wake up just like they wake up from the sleep, is what you have to basically remember. Flumazenil is the antidote for benzodiazepine overdose. Bile acid resins, they lead to GI upset, malabsorption of vitamins and medications. We use bile acid resins to treat hyperlipidemia. But bile acid resins can cause hypertriglyceridemia, and they interfere with the absorption of the fat-soluble vitamins is what you have to remember. Then comes carbamazepine. So like this, Totally, I am going to discuss 300 high-yield facts in this session, doctor. 5 to 6 points about each of the drug you have to have in your mind, and sure short questions will come from that. Carbamazepine can lead to P450 induction. So that is the reason it lead to auto-induction. It lead to P450 induced, and that P450 will metabolize the carbamazepine. उनका प्रोडक्ट उन्हीं को मेटाबोलाइज कर लेगा बच्चों. Because of that, you need to increase the dosage 2 to 3 weeks after initiating therapy with carbamazepine. Carbamazepine, a granulocytosis. Carbamazepine, aplastic anemia. Carbamazepine, liver toxicity. Please don't forget. Carbamazepine is also used for trigeminal neuralgia. Liver function test and CBP. 2 things you need to. Because carbamazepine can cause bone marrow suppression. Bone marrow suppression can lead to granulocytopenia. That's the reason monitor CBP. Carbamazepine can lead to Stevens-Johnson syndrome. Oh my God, very bad Stevens-Johnson. Especially HLA-B 1502 positive patients is what you need to remember. Then comes the calcium channel blockers. Peripheral edema, lot of granima still. Doctor, मेरे पाँव में सूजन हो गया. Doctor, नानीबा, आपकी ड्रग्स क्या क्या दे रहे? रिसेंटली वो डॉक्टर साहब ने मेरा बीपी टैबलेट बदल दिया बेटा. क्या बदला? एम्लोडिपिन कर दिया. So amlodipine like calcium channel blockers, peripheral edema, constipation, cardiac depression. So calcium channel blockers, 2 uses, both hypertension and angina. And the dihydropyridines. What are dihydropyridines? Nifedipine, nimodipine, amlodipine, nicardipine, they all lead to edema. Whereas diltiazem, verapamil, they are called non-dihydropyridines, can treat arrhythmias, is what you need to remember. Chloramphenicol, what will you remember? Aplastic anemia, Gray baby syndrome. It's a broad spectrum antibiotic. But problem with chloramphenicol is chloramphenicol can cause a dose-dependent aplastic anemia. Bone marrow suppression is what you should not basically forget. And chloramphenicol, what are the 2 important scenarios? Rickettsial infections, anaerobic infections. ये दोनों को chloramphenicol. Nowadays, nobody is using chloramphenicol that often. Once upon a time, we used to use doctor. Now, cisplatin, 2 things. Nephrotoxicity, acoustic nerve damage. Nephrotoxicity, kidney, acoustic nerve damage, deafness. Cisplatin दिए तो hydrate करना. Cisplatin दिए तो diuretics नको देना बेटा. Diuretics, of course, you can hydrate and give diuretics. If you do that, then nephrotoxicity can be prevented. But only the diuretic if the patient gets dehydrated, cisplatin concentration worsens. Cisplatin is known to lead to lot of emesis, nausea, vomiting, boluses of vomiting. And for a lot of solid tumors, we use cisplatin. Clonidine, किसको फेवरेट है भैया? क्लोनिडिन नेफ्रोलॉजिस्ट को बहुत फेवरेट है. काइको? क्योंकि नेफ्रोलॉजी में बीटा ब्लॉकर्स इस्तेमाल किया, अल्फा ब्लॉकर लाइक प्रेडोसिन भी दिया, और कैल्शियम चैनल ब्लॉकर्स भी दे दिया. सब देने के बाद भी पेशेंट का बीपी ऊपर ही चढ़ के बैठ गया. The BP is not coming down. Then what will you do? You have to give Clonidine. Arcamin is the brand. 100 micrograms we give Clonidine. Clonidine can cause dry mouth, severe rebound headache, hypertension. Only nephrologists it is a favorite drug. If you give Clonidine, even a refractory hypertension will normalize and come back. And it is used for hypertension. Clonidine is used for hypertension. And ADHD is what you have to basically remember. Right? So that is the very important part of the story, doctor. Don't forget. और इस पीडीएफ के लिए आप नीचे वाले नंबर को व्हाट्सएप करना, आपको हमारे स्टडी ग्रुप में ऐड करेंगे और आपको दिलाएंगे. So clonidine is used for ADHD. Clonidine is for ADHD. Please don't forget. Right, doctor? Yeah, 1 minute. Give me a minute. Clonidine is used for ADHD is what you have to remember. Right. Good to see 11 online classmates. Clonidine can cause bradycardia. What is the mechanism of action of clonidine, doctor? We have alpha-1, alpha-2 receptors. Alpha-1 receptor stimulation lead to vasoconstriction and it leads to rise of the blood pressure. Alpha-2 are centrally located. Alpha-1 is postsynaptic, alpha-2 is presynaptic. Please don't forget. And this alpha-2 centrally located, if you stimulate it, agonize it, it decreases the sympathetic outflow. That is what clonidine will do, centrally acting antihypertensive. It goes and act as an alpha-2 receptor agonist and decrease the sympathetic outflow, leading to the development of a decreased BP. And whenever you give clonidine, gradually withdraw it to avoid rebound hypertension. अभी आ गया clozapine. तो ultimately preparation for exam means भजन करना है बेटा, भजन करना है और भगवान के पास पहुंचेंगे. राइट? तो वो भजन के लिए तैयार रहना है. एक बार, 2 बार, 3 बार, 1000 बार बोलो हर हर महादेव शंभो शंकरा. Clozapine leads to a granulocytosis. And what is clozapine called? A typical antipsychotic. If you are using typical antipsychotic, schizophrenia is not coming down, then a typical antipsychotic, clozapine, is used for the treatment-resistant schizophrenia. Clozapine, propylthiouracil, carbamazepine. What is the common thing for all of them in side effects? They all lead to a granulocytosis. Bone marrow suppression. Clozapine, whenever you are giving, try to monitor WBC count. Just like in the case of propylthiouracil. Clozapine can lead to seizures. Clozapine can cause myocarditis. Please don't forget. Then comes steroid. The quack, RMP सीनू क्या देता? कुछ भी हो वो प्रेडनिसोलोन दे देता, कुछ भी हो हाइड्रोकॉर्टिसोन दे देता, कुछ भी हो डेक्सामेथासोन दे देता. खाली उनको एक ही दवा देना आता है, वो है स्टेरॉइड. Today in India, 70% prescriptions are given by medical shop fellows and the quacks. So स्टेरॉइड से क्या होता है? डिप्रेशन. Steroid psychosis can occur. Steroid lead to acutely hyperglycemia. Steroid lead to immunosuppression. Steroid lead to osteoporosis. Steroid lead to thinning of skin, easy bruising, myopathy. Chronically, steroids lead to cataracts. And if you withdraw steroid, there are symptoms of adrenal insufficiency leading to hypotension. And while you are giving steroids, steroids lead to hypertension. If you withdraw them, they lead to adrenal insufficiency, and hypotension is what you need to remember. Steroids can lead to peptic ulcer, is what you need to remember. Then comes cyclophosphamide. Cyclophosphamide, myelosuppression, hemorrhagic cystitis, bladder cancer. And how do you avoid that? Whenever you give cyclophosphamide, give Mesna to prevent hemorrhagic cystitis. Cyclophosphamide is used in malignancies, autoimmune diseases. Cyclophosphamide can lead to alopecia, syndrome of inappropriate ADH secretion. Cyclophosphamide can lead to gonadal suppression. Gonadal suppression. Please don't forget, whenever you are giving to an SLE patient cyclophosphamide, you need to get a consent form saying that I understood the risk of cyclophosphamide, that it can lead to sterility. I may not have children. The doctor completely explained, you need to take a consent, otherwise the patient will come and take away your children. Now, doctor, digoxin. Digoxin, most common side effect is not on the heart, it is on the gut. So GI disturbances. Digoxin can lead to yellow visual changes. Digoxin can lead to arrhythmias, junctional tachycardia. Digoxin-induced supraventricular tachycardia. Digoxin has a narrow therapeutic index. Digoxin is used to control the ventricular rate whenever patient has atrial fibrillation. So digoxin is used in heart failure and atrial fibrillation. Digoxin by itself can lead to hyperkalemia. That's the reason you need to monitor serum potassium levels. But if there is hypokalemia, it can lead to digoxin toxicity. Hypokalemia lead to digoxin toxicity lead to hyperkalemia. Please don't forget, this is one of the favorite questions of the examiner, doctor. Diphenhydramine, very commonly used in all our cold cough medications. It has anticholinergic effects, tachycardia, hyperthermia, mydriasis, reduced bubble sounds. It is antihistaminic, drowsiness, confusion. It is used for insomnia, allergic reactions. And elderly people, be careful always. If you use the common cold preparations, it can lead to the development of urinary retention, especially older adults. It can lead to diphenhydramine overdose, can lead to delirium, hallucinations. Next comes doxorubicin. So doxorubicin, breast cancer they use it, doctor. I have seen n number of cases of doxorubicin, बहुत सालों के पहले डॉक्टर साहब doxorubicin दिया और अभी cardiotoxicity develop हो गया. So doxorubicin can cause cardiomyopathy, discolored urine. It required monitoring of cardiac function for a long period of time, and it can lead to cumulative dose-related toxicity. Ethyl alcohol, शराब पीने से क्या होगा? Acidosis, renal dysfunction, CNS depression. It can lead to hypoglycemia in chronic alcoholics. It can lead to Wernicke-Korsakoff syndrome and delirium tremens on withdrawal. Fluoroquinolones, ufloxacin, levofloxacin, glivofloxacin. It can lead to cartilage damage to the children. It can lead to a spontaneous rupture of the Achilles tendon in adults. Fluoroquinolones can cause prolonged QT. Broad spectrum antibiotics is one advantage of fluoroquinolones, but avoid in pregnancy, avoid in children. Then comes furosemide. Can the online students can punch? Is the voice loud and clear? Nice to see. Dr. Mohan Pawar. Dr. Khadija Buhani, Kuldeep, and many more who are all online, doctor. Yeah, don't forget, please like this video. Please share this video on Instagram, Telegram, any gram that you are on. And please tell all your friends to make this a viral video of the sprint sessions. 500 sprint sessions I am going to publish. You want PDF of this sprint session, please go to the learnograph.com or give a call to the phone number I gave below. And Mary, our manager, will help you to join our WhatsApp study group and get the PDF. Furosemide lead to ototoxicity, hypokalemia, nephritis, gout, very important. Furosemide can lead to hyperuricemia, which can lead to gout. Furosemide is a loop diuretic in heart failure and edema. Whenever you are giving furosemide, monitor the potassium, calcium levels and renal function. Furosemide, the common loop diuretic, can lead to dehydration, hypotension. Then let's talk gemfibrozil. Gemfibrozil lead to myositis. Where we use gemfibrozil? Normally we use statins for hypercholesterolemia, gemfibrozil for hypertriglyceridemia. And it will cause a reversible increase in LFTs. Gemfibrozil can lead to gallstones. It can potentiate the effect of warfarines, sulfonylureas, very dirty drug interactions of gemfibrozil. Halothane. So many times this question was asked in the neetpg exam. And nice to see Madhu, Sindhu, and many more. Thank you for joining, Doctor. Please like this video profusely and not necessarily in the chat window. After the session is over, please write your comments, your compliments, your critics, everything that you felt about this session in the comment box. Once you comment more, YouTube will populate it more, and that will make this viral. So please help us to make this video viral and useful for many. So halothane can lead to hepatotoxicity, malignant hyperthermia, inhalational anesthetic, and it can lead to hypotension, arrhythmias. And whenever you give halothane anesthetize, it can lead to post-operative fever, it can lead to eosinophilia. Don't worry, after anesthetizing the patient when he develops eosinophilia. Then comes hydrochlorothiazide, the common Telma H का इस्तेमाल करो. H क्या होता है? हाइड्रोक्लोरोथाइजाइड, क्लोरोथाइलिडोन. So hypokalemia, hyponatremia, hyperuricemia, hyperglycemia, hypercalcemia. That is the difference. Loop diuretics lose calcium. Thiazide diuretics retain calcium. और एक बार मेरे साथ बोलो, हर हर महादेव शंभो शंकरा. Loop diuretics lose calcium. Thiazide diuretics retain calcium. So what is the common thing between loop diuretic and thiazide diuretics, doctor? Both of them lose potassium. Hydrochlorothiazide also lead to hypokalemia, hyponatremia, hyperuricemia, hyperglycemia, hypercalcemia. Thiazide is the first line for hypertension, especially isolated systolic hypertension in elderly. और एक बार मेरे साथ बोलो, isolated systolic hypertension in elderly. What is the drug of choice? Hydrochlorothiazide. Please don't forget, oh Italia. Oh my doctor, oh Italia. Be cheerful, oh. Then only you will get oh Cito in neetpg. Please. Don't say, I'm pissed off, I can't remember, I may forget, what to do, sir, I'm nail biting, sir, my finger also bitten, sir. No, doctor, oh, this is the happiest memento of your life, oh, you should enjoy it, okay? Hydrochlorothiazide can cause photosensitivity. Hydrochlorothiazide lead to hyperuricemia. That's the reason avoid it in patients with gout. So, ये PDF को पकड़ के आप कोई फ्रेंड के साथ बैठना, और you bite your friend bites you, but ultimately you both bite this content, right? Definitely at least 2 to 3 questions you are pocketing into for the tomorrow's neetpg, FMG, whatever damn exam it is. HMG CoA reductase inhibitors are statins, but if you give statins, there can be myositis. If you use statins, monitor the LFT. If you are using statins, there is a risk of rhabdomyolysis. That's the reason monitor CPK levels if there is any proximal muscle weakness. And statins lead to type 2 muscle atrophy. Statins are used for hypercholesterolemia. Hydralazine is known for drug-induced SLE. It is used for hypertension, heart failure. It can lead to vasodilatation, due to which there is a reflex tachycardia because of your baroreceptor reflex. And hydralazine can cause drug-induced SLE. That's the reason monitor AMA levels in long term. Hydroxychloroquine. So whenever you are using, especially SLE patients, connective tissue disorder patients, whenever you use hydroxychloroquine very long, you need to look for annual ophthalmological exam, retinopathy, bull's eye, maculopathy. What is that? और एक बार मेरे साथ बोलो. Bull's eye, maculopathy can occur with hydroxychloroquine is what you need to remember. So chloroquine is used in malaria short term and autoimmune disorders long term. Chloroquine can cause QT prolongation, monitor the blood count and liver function. INH can lead to peripheral neuropathy. To prevent that, we give pyridoxine, the vitamin B6. INH can lead to hepatotoxicity. It inhibits the P450, not induce that, inhibit. It can lead to seizures whenever INH overdose is there. INH can lead to hemolysis in G6PD deficiency. INH is the first line in TB treatment. INH जब देते हैं LFT regularly monitor करो. INH just like hydralazine can lead to drug-induced lupus. So doctor, my great-great-great-grandfather, he used to be a Vedic scholar and he used to run the school of Veda in the Ganges of Krishna River in Andhra Pradesh. So those days, even today, there is no script in Vedas. But for thousands of years, the Vedas used to continue just by the rhythm of the music, the rhythm of utterance in the minds of the people who learned Veda. So like the Vedas, you should master all these 50,000 high-yield facts with Dr. Murali Bharadwaj, right? So very nice to see Vikas Jadhav and many more. So Vikas Jadhav and everyone, please also write your comments in the comment box below the video after the video is published. That will help a lot of the YouTube will make this viral. The more and more the number of people comment it, criticize it also is okay, but do something and also like it and share it so that it become viral. So now, doctor, let's go to the next question. Next drug, MAO inhibitors. If you happen to give it, it can lead to serotonin syndrome if meperidine and MAO inhibitors combine. It's called serotonin syndrome. It can lead, if you happen to give cheese, pizza खाने को invite करो MAO inhibitor लेने वाले patient को. Hypertensive tyramine reaction आके पिज्जा हट में ही वो मर जाएगा. MAO inhibitors are used for atypical depression, Parkinson's disease. Avoid tyramine containing foods and there is a risk of orthostatic hypotension when you are using MAO inhibitors. Metformin can lead to lactic acidosis, especially when patient has any acute kidney injury or dehydration or sepsis. Stop metformin, otherwise it leads to lactic acidosis. Withhold metformin until the condition improves. For type 2 diabetes, it is the first line therapy. Metformin can lead to vitamin B12 deficiency. Metformin is a euglycemic agent. There is no hypoglycemia risk. Metformin can lead to, it is called weight neutral. Unlike the glimepiride, gliclazide, glibenclamide, all these sulfonylureas will cause the gain of the weight. Dapagliflozin, empagliflozin, all the glyphosins lead to weight loss. But metformin is weight neutral. Then comes methanol. Methanol can cause anion gap metabolic acidosis. blindness. And what is the antidote? Fomepizole for methanol. And ethanol is the antidote for the methanol poisoning, is what you need to remember. Methanol can cause CNS depression, and in severe cases of methanol toxicity, you require hemodialysis. It's a dialysable toxin. Methotrexate. Methotrexate can cause hepatic fibrosis, pneumonitis, anemia. Where do we use methotrexate? Cancer, autoimmune diseases. You give folate supplementation to reduce the methotrexate toxicity. Monitor the CBP and LFT. Metoclopramide. Metoclopramide is a dopamine antagonist. That's the reason it can lead to extrapyramidal reactions like akathisia, Parkinsonism, acute dystonia. And where we use metoclopramide, whenever you need antiemetic, gastroparesis, and in long term, it can lead to tardive dyskinesia because of the dopamine deficiency. And wherever bowel obstruction is there, never give metoclopramide. It is contraindicated. So don't forget about metoclopramide. So you will remember me in exam hall. Sure shot, 3 to 4 questions are going to come from today's sprint. Sprint number 3. Sure shot, doctor, take it as my word. Right? So, who is a real hero teacher? Hero teacher is not the one who extensively educates you. Hero teacher is the one, a dream team teacher is the one crisply summarize and feed you with the high yield facts, definitely going to come in exam. Methyl dopa, if you give Coombs positive, it can lead to drug-induced SLE. And where is methyl dopa commonly used? Who uses them? Obstetricians, pregnancy-induced hypertension. Methyl dopa can cause Coombs positive hemolytic anemia, and monitor the LFT. Metronidazole can lead to disulfiram reaction, vestibular dysfunction, metallic taste. Metronidazole is effective against the anaerobes, protozoa, and avoid alcohol during treatment, and it is used in Clostridium difficile infections, is what you need to remember. Right, doctor? Just give me a minute. Yes, doctor. Yeah. Good. Good to see 16 online classmates. Very good. And I'm happy that hope the image is all, the letters are all very clear. Now, metronidazole, typically what does it lead to, doctor? Disulfiram reaction, vestibular dysfunction, metallic taste, very commonly used. TID, metronidazole, it is effective against both protozoa and anaerobes, and avoid alcohol when you are taking metronidazole. And Clostridium difficile infection. What is the best drug, doctor? Metronidazole is the best drug, is what you need to remember. Yes. Is the screen visible, doctor? Hopefully. Yeah. Now, mycophenolate mofetil. Mycophenolate mofetil can cause bone marrow suppression, used in transplant rejection prophylaxis, and it can cause GI disturbances, and you need to monitor the CBP. Very important. Next comes the niacin. Niacin can cause cutaneous flushing. It can cause hyperglycemia, hyperuricemia. Of course, we are not using niacin. It is one of the dirtiest drugs. It is used in hyperlipidemia. And the niacin-induced flushing, how can you prevent it? You can prevent it by giving aspirin. Niacin-induced flushing can be prevented. Then comes the nitroglycerin. It is used for angina, heart failure, sublingual form, you give sublingual nitrate, sorbitrate. And if the patient is taking, so we use lot of forms of nitroglycerin, isosorbate, dinitrate, right? Mononitrate. If the patient is taking sildenafil, PD, the phosphodiesterase 5 inhibitors. So don't give the nitroglycerin, be careful. So nitroglycerin, whenever you give it, can lead to headache. Long time, nitroglycerin can cause tolerance. It can lead to hypotension, tachycardia can occur because of the nitroglycerin. Penicillamine can lead to drug-induced SLE. It is used in Wilson's disease, rheumatoid arthritis, but penicillamine is another dirty drug. It can lead to nephrotic syndrome. Always monitor CVP and LFT. Beta-lactams, they can lead to hypersensitivity reactions. And beta-lactams can lead to interstitial nephritis. They're effective only against gram-positive, not gram-negative. So E. coli and all your gut organisms, penicillin is not effective. Only they are effective against streptococcus, pneumococcus, all these cocci, which are gram-positive. So if they are effective against gram-positive, and they have a cross-reactivity with the cephalosporins, is what you need to basically remember. Then comes phenytoin. Nystagmus, diplopia, ataxia, erythmia, gingival hyperplasia, hirsutism, teratogenic effects, they all need to be remembered in relation to phenytoin. Phenytoin is used for the prophylaxis of seizures. Phenytoin can induce the P450, and always monitor the phenytoin levels. Modern practice we are all giving Levi pill, levetiracetam, 500 milligrams. Very rarely we are using phenytoin, right? Now, prazosin. Prazosin is the first dose hypotension. Prazosin can lead to priapism. Prazosin is used not only to treat hypertension, also for post-traumatic stress disorder. It can cause nasal congestion, and you monitor the BP closely with prazosin, is what you need to remember. Then procainamide, what are you going to remember, doctor? Drug-induced SLE. Procainamide is the drug that can prolong the QT. Procainamide can be used for atrial and ventricular arrhythmias, and procainamide whenever you are giving monitor the ANA. Propyl thiouracil, drug used for hyperthyroid patients. Always remember, propyl thiouracil, whenever you give to the patient PTU, you need to monitor their WBC count. Just like clozapine, carbamazepine, propyl thiouracil, these are the three drugs. You need to carefully remember, doctor, you need to monitor the WBC count. So propyl thiouracil can cause aplastic anemia, granulocytosis. You need to monitor thyroid and also the liver function. Quinidine can lead to synchronism, that is headache and tinnitus. Quinidine thrombocytopenia. Quinidine prolongs QT leading to torsades de pointes. Quinidine is used not only in malaria but also as an antiarrhythmic in atrial fibrillation. Monitor ECG. Look for the prolonged QT whenever you are giving the quinidine. Reserpine. Modern time we are not giving. Old timers used to give reserpine. It is used for hypertension. It can lead to depression, suicidal depression. It can cause nasal congestion, GI upset, risk of orthostatic hypotension. Rifampicin क्या होता है? Raja among the chemicals for treating TB. You deprive the patient of any TB drug but not rifampicin. Rifampicin induced P450. It can lead to orange, red colored urine. Tell the patient before only. Rifampicin is used in TB and also leprosy. Rifampicin can cause hepatotoxicity like INH. Monitor the LFT. Salicylates. Salicylates are used to treat pain, to treat inflammation. But remember, favorite question of the examiner. What is the side effect of salicylates? Salicylates can lead to hyperthermia. Those salicylates are used to treat inflammation, fever and all. By themselves, if the salicylate toxicity is there, it leads to fever, is what you need to remember. Hyperthermia. Lot of times don't use your common sense in exam hall. If you think, salicylates are used for inflammation, why will they cause hyperthermia? बोल के अगर एग्जाम में अगर आप सोच लिया तो सत्यानाश हो जाएगा. Salicylates, excess toxicity lead to fever, hyperventilation with respiratory alkalosis. Salicylates by themselves lead to metabolic acidosis. Two types of acid-base disturbances with salicylates. Because of the hyperventilation, respiratory alkalosis, and they also lead to metabolic acidosis. There is a development of dehydration, diaphoresis, hemorrhagic gastritis, and overdose of salicylates. How can you treat? Salicylate toxicity is treated with alkalinization of the urine by giving sodium bicarbonate, is what you have to remember. SSRIs, selective serotonin reuptake inhibitors, selective serotonin reuptake inhibitors, SSRIs. अगर हमको आनंद मिल गया तो कैको मिलता? हमको आनंद मिलेगा सेरोटोनिन ज्यादा बढ़ने की वजह से. अगर हमको डिप्रेशन हो गया तो कैको होगा? Our depression is because of low serotonin. That's the reason by increasing the serotonin levels, SSRIs are the first line of treatment of depression and anxiety. Escitalopram, fluoxetine, all this. And they can cause weight gain. SSRIs can cause weight gain. And if you combine SSRI with MAOI inhibitors, it leads to serotonin syndrome. SSRIs can lead to sexual dysfunction. Weight gain मिलेगा, depression कम होगा, मगर sex में problem हो जाएगा SSRIs के वजह से. And if you abruptly discontinue, there is a risk of withdrawal symptoms. Can the online students can see the Letters clearly, doctor. Please punch your feedback. Now, succinylcholine can lead to hyperkalemia, malignant hyperthermia. They are used for rapid sequence intubation. And succinylcholine lead to the fasciculations in the muscle. Hence, post-operatively, patient will have muscle pain. And succinylcholine is contraindicated in patients who have myasthenia gravis, like neuromuscular disorders, is what you need to basically remember. Now comes tricyclic antidepressants. One of the very bad thing lot of people write in their prescription is, whenever there is any diabetic neuropathy to the elderly person, they will combine gabapentin 200 mg or 100 mg or 400 mg with amitriptyline. Please don't do that. I have removed amitriptyline from the drug box of so many elderly people. So tricyclic antidepressants have anticholinergic effects. Because of that, the mouth become dry. There is bladder retention of the urine, urinary tract infections. All these are the issues with tricyclic antidepressants. Please, please, please don't give them to the elderly people. And it can lead to fatal arrhythmias. It can cause weight gain, sedation. But tricyclic antidepressants, unfortunately, are used profusely by these neurologist guys to treat neuropathic pain, depression, etc., etc. But kindly don't do that. TCAs can lead to QRS prolongation, arrhythmias, coma is what you need to remember. Then comes tetracyclines. Tetracyclines. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Tooth discoloration, photosensitivity, outdated tetracyclines can lead to development of Fanconi syndrome. Please don't forget, doctor. Outdated tetracyclines, Fanconi syndrome. So many times asked. Tetracyclines lead to GI distress. All of us know. If you take a doxycycline, it can lead to esophageal irritation. A lot of us took doxycycline 100 milligram during the time of COVID. Avoid tetracyclines in pregnancy and children under the age of 8 years. Tetracyclines are used for acne. Tetracyclines are used for atypical infections. किसी को बुखार हो गया, फीवर हो गया, कोई भी एंटीबायोटिक दिए तो भी कम नहीं हो रहा है, फिर भी फीवर आ रहा है, डॉक्सीसाइक्लिन ट्राई करो 5 days, 100 milligram twice daily. खत्म. आपका atypical organisms associated infections are dramatically treated by tetracyclines. Tetracyclines, in fact, are the treatment for many rickettsia, chlamydia, so many places tetracyclines are the drug of choice. Trazodone, trazodone से क्या tragedy हो जाएगा? Priapism, the patient's penis does not come down. It remains hoisted as long as it can. And the patient's wife will say, oh, what a kind of doctor you are. You gave to treat my husband's insomnia, depression, and the whole night his penis is fully hoisted. What to do, doctor? Patient will ask you. Trazodone, tragic thing is priapism. So many times this was asked. Trazodone can cause sedation, orthostatic hypotension. And whenever you give trazodone, monitor for serotonin syndrome. Now comes trimethoprim. Trimethoprim, megaloblastic anemia, trimethoprim, leukopenia, trimethoprim, granulocytopenia. Trimethoprim can go and affect the renal tubules and can lead to the development of hyperkalemia. So many times asked. Often used along with sulfamethoxazole. Trimethoprim can cause rash and GI upset, and always give folate supplementation with trimethoprim. So where is trimethoprim, sulfamethoxazole very popular, doctor? All the retroviral patients, double strength trimethoprim, sulfamethoxazole we give. Right? Double strength trimethoprim, sulfamethoxazole we give. And the whole purpose of giving like that is to prevent Pneumocystis caridinae, pneumonia is what you need to remember. Now comes valproate. Valproate can lead to teratogenicity. It can lead to neural tube defects, fetal hepatotoxicity, used for seizures, bipolar disorders. Always monitor LFT, CBP when you are giving valproate. It can lead to weight gain. It can lead to tremor. Please don't forget. Now comes finally 3 drugs, doctor, before we call the end of this sprint. Vancomycin, vinblastine, vincristin. Fat bolo. Vancomycin nephrotoxicity. Vancomycin ototoxicity. Vancomycin causes the release of histamine, leading to vasodilatation, leading to red man syndrome. It is not anaphylaxis. It is not allergy. It is called anaphylactoid reaction, red man syndrome. Vancomycin is used for MRSA. Vancomycin is typically used for Clostridium difficile associated pseudomembranous colitis. Vancomycin, whenever you are giving, monitor the serum levels to avoid toxicity, infuse slowly, otherwise you will lead to red man syndrome. Vinblastine, vincristin. Blastin B for bone marrow suppression, cristin C for CNS toxicity. Just simple to remember. Vincristin C for CNS toxicity, vinblastine B for bone marrow toxicity. Vinblastine typically lead to severe myelosuppression. Vinblastine is used for Hodgkin's lymphoma. Vinblastine for testicular cancer. Vinblastine can lead to alopecia, and monitor the CBP because it leads to myelosuppression. Vincristin lead to peripheral neuropathy, paralytic ileus. It is used for leukemia, lymphoma. It can lead to neurotoxicity. Monitor the neurological functions. So, Shanti, Shanti, Shanti. This is the sprint session number 3 that we are having, doctor. And remember that the whole secret of winning is all about focus, mastering 50,000 high yield facts. And I'm going to give you a PDF shortly on the learnograph.com. We are going to publish a ebook PDF. 11,000 MCQs, PYQs in the last 10 years. We are going to print it along with clinical Vinet based new questions based on them. So you get PYQs plenty in the market, but based on that, what are the future clinical Vinet based questions going to be asked? We are going to print. Maybe for those preparing for the next year of neetpg, but still we have another 2 weeks, 3 weeks of time, 2 weeks of time. Shanti ke saath padho, roz padhenge. Please don't forget to like this video, share this video, and नीचे के नंबर अगर आप WhatsApp करें तो Mary, our manager, will join you in our WhatsApp study group. Also share that group link to all your friends. And this is Dr. Murli Bharadwaj. In the past 25 years, I have opportunity to mentor 3 lakh medical students. Today in Hyderabad, I am practicing as a physician with my own students. Once upon a time, who sat like you, preparing for entrance. They had the same insecurities, yaad rahega, nahi rahega. But today, they are urologists, nephrologists, CT surgeons, cardiologists, neurosurgeons. Oh my God, my privilege to practice along with them. So like that, one day, you will also become my colleague. We'll all discuss the cases to find the best way to treat them. Difficult cases, easy cases, right? So with that dream, you are born with a purpose, doctor. Remember, God created you with a purpose. You are not an ordinary human being. You did medicine mix. So with that prayer, you should start. God, you created me, made me MBBS out of millions of people who aspired it. One more game. Please also make me the topper in the entrance and give me a government seat, Bhagwan. And with clarity, you don't need to read tons and tons of material. All these face-to-face classes, apps, video libraries. Oh, sir, they're only to inspire you. But ultimately, you need to have focus. Your own clear-cut understanding of this 50,000 high-yield facts, what the examiner want, and then go to the exam. And have 2 to 3 friends who will do revision with you. And that is all that you need. You don't need anything else to become a topper. And if some topper told you that, hey, I used to read 12 hours, 10 hours, forget him. If somebody reads 10 to 12 hours for this kind of heat, he may be a topper, but he will end up in testicular atrophy. For the kind of the heat we have, sitting 10 to 12 hours and reading, too much, right? So be careful before marrying toppers. So, doctor, you require very little focused reading, confidence, common sense, and knowing the common high-yield facts. That's all, right? Good luck. And every day, every time I get time, I keep adding some more sprints and sprints to do the revision. And we will be meeting in this war and battle to become the topper. We fight on the sea, we fight in the air, we fight on the ground. We dream to get the freedom by becoming the postgraduate of our choice, in our terms. Good night.